Hello, welcome to the Geri Academy podcast with your host, geriatrician Dr. Golnoosh Sharif Saleh, providing you with information on aging-related topics. Learn more at geriacademy.com and follow me on social media. Hello, welcome to the Geri Academy podcast with your host, Dr. Golnoosh Sharif Saleh. Today, we were going to talk about bereavement, especially during the time of COVID. Our expert today is Laura Roach. She is a licensed social worker who works for Burke Hospice. Hi, Laura.
Hi.
How are you?
I'm doing well. Thank you.
Thank you for discussing this topic with us. It's very important. I know that it has caused a lot of difficulty for me, just being a physician in the hospital, and I can only imagine how hard it is for our patients and their loved ones.
Yes.
So before we start, can you tell me a little bit about yourself?
Sure. So I am the support services coordinator at Burke Hospice and Palliative Care. And so I supervise our support staff, which is our bereavement team. And I'm a licensed clinical mental health counselor, as well as a chaplain with my master's in divinity. Those two worlds together every day, my work.
And I remember one of the first times that you and I met, one of my dear patients was passing away. And I remember you singing at his bedside before he passed. It just changed the mood of the entire room. One of the things that's been really difficult now is that our patients are dying alone in the hospital because of this pandemic. And even when they're going into hospice, our contact with our patients has been limited because of our PPE shortages. And I mean, it's been a mess. Tell me a little bit about your experience.
So we have experienced those challenges too. You know, sometimes it's advocating for families to see their loved ones when we can't even go in and evaluate what their needs are. And so that has been, we're glad to do that, but it's difficult when we don't know how to prepare them. We're finding new ways to support them than what's been typically done for, really centuries sometimes about how to provide support and care, especially in the dying process.
So what I'm going to do is just define bereavement really quick for our listeners, and that might help explain why this topic is so important today. But it's really the experience of losing a loved one. The bereaved can be a close friend, family members, an animal that was in that person's life. And so the loss of that close relationship affects these people really strongly and in different ways. And the importance of our loved one in our lives is one of the reasons that their death can be such a significant impact. And really being able to connect and be near that loved one before they pass away is also a part of having like normal grief and processing, which I have found to be so complex during this period, right?
Yes.
Tell me a little bit about what is going on in the hospice world.
Well, I think we're just now seeing some of the impacts of what you're discussing. Grief and loss and change, sometimes we use interchangeably. And we don't talk about loss and grief and bereavement very much in our culture. And yet we all experience it in some form or fashion. And so here we have seen anger that's increased. It's normal in grief, but is elevated. We have seen isolation, of course, due to the pandemic, but that is increased because what do we do when we grieve as a culture? We gather. That's what we know how to do. And so many people have been perplexed about, number one, the knowledge that they are grieving. And then number two, if I do know that I am, what do I do with it? Because the normal things that I'm used to doing are not available to me. And so those are some of the challenges.
Processing through that sadness, like the disbelief that your loved one is gone. And, previous to the pandemic, it was like your neighbors were coming over to your house with food and people were hugging you and holding you. And right now, like that touch is gone. That
Yes.
personal sense of like family from your community, that is gone. And I think even in terms of churches, right? Churches are
Yes.
such a great support system for individuals. And that's, there's been this disconnection too.
Yes.
And I can only imagine, for us, one of the things I've experienced is that, I'll go home every night. My husband does critical care. And I'm like, how was your day? And he says sad.
Mm-hmm.
And that is all he says. And other times it's like when we're losing a patient, I sometimes kind of think, like, I get sad, right? But then a part of me is like, pull yourself together. Imagine how this family member is feeling.
Right.
But I can't be there to comfort that family member. And I can't be there to educate them the same way.
Mm-hmm.
What have you guys been doing to try to accommodate for these changes?
So, this has forced all of us to kind of reevaluate every aspect of our lives. But, I found myself having conversations with people about planning for their own grief and loss, maybe in a way that we haven't had to talk about before. Creating a memorial garden. And really, they sound like simple things, but they have intention. And so people talk about they're used for the purpose of remembering. And so, I've encouraged people to, when you can't gather, your friends can't do the things that you just mentioned, church can't do the things that you're used to doing. Ask them for written memories of your loved one. Ask them to do things differently. And that's okay to do. We're not good at that, generally speaking, asking people to do these things to help us in our grief and loss, but encouraging our patients and families and anybody in my life to be thoughtful about what you need and reaching out, because that's so important.
Now, are you using virtual platforms or teaching individuals? I know your population can be older. I mean, you guys have
Yes.
individuals of all ages, but mostly your patients are older in the hospice world. How have you been able to utilize technology and virtual visits maybe to help your patients out?
So that is a challenge. A lot of people feel uncomfortable using this technology that they've never used before, but we do have a virtual meeting for bereavement support. We've not only open to our patients' family members, but to anyone in the community who would like to do that. And that happens on Thursday evenings. Some people are comfortable meeting in a socially distanced way to share about, their loved one. We are trying to do some of those things. And then grief is also important because it's a healing process. So I think they're sharing more. People who are generally quiet, withheld, they don't want to open up in a positive way are finding that they're seeking it out. A close friend, they're meeting a group of widows who meet in a distance way. They're wearing their mask, but they're talking about their loss and finding places to laugh and remember and be open about their grief.
Do you think that the process of adapting to loss has changed because of COVID? Do you think it's taking longer now to adapt? The grieving process is longer?
Yes. I was speaking with a colleague who lost her mother early on in the pandemic, and she was in a skilled facility and couldn't be with her. And she'd been seeing her every day. And she created this beautiful picture to me. And she said, I think when we unmask eventually, as a culture, society, a world, that my grief will also be unmasked.
Oh, wow.
And I thought, how beautiful and how symbolic. And I think a lot of people are in a way holding their breath until their grief can be unmasked. And so there are elements of things that we can do now, but some things that are on hold.
But then we have these COVID patients that are like now unable to go home and be near
Mm,
their loved ones because a spouse is also high risk for developing COVID. So they're
mm.
staying in our facility and passing away in the hospital, and we're trying to be there for these patients, but that spouse doesn't even get that chance to say goodbye. And so how
Mm.
how do we, right, once you do take that mask off, how do you start to grieve when you didn't even experience that process?
Right. And so I think the acknowledgement of that is so vital. If we try to stunt our grief, that's when it can become complicated, because grief is the process to heal. We have to go through the pain to heal. Not unlike, after your patient has a surgery and they have to go through pain of rehab to heal. It's very similar, the heart and mind and spirit in the grief process. We have to allow ourselves to feel the emotions of the loss, the pain of the loss. And grief is so strange because it can bring about tears and laughter and anger and all those things mixed together. And what I find consistently, pandemic or no pandemic, is people feel like they're crazy. They feel like they're losing control. Something's wrong with them. And that's what creates, this need to hide away, this need to not let people see me, not let them know that I'm grieving, because it can come suddenly. You can be in the grocery store looking at eggs and be in tears or whatever it is, can seem so strange. And so the acknowledgement of that is number one for that process to start.
It can go on for so many years,
Oh,
and that's
yes.
normal.
Yes.
I think
Yes.
normalizing that is so important, and that's something that people don't do. They're like, okay, this happened, I have to move on now after a
Yes.
certain period of time. But that looking at the eggs could be 10 years away. It doesn't
That's
necessarily have to
exactly
be,
right. That's
right?
exactly right. And, grief is not linear. Sometimes it's cyclical. And, we want things to be linear. We want them to make sense. And okay, I did this stage in grief, and then now I go to this stage. It's not black and white like that. And I think that's what confuses a lot of people is, I thought I was in a good place. That's what I hear all the time. I thought I had accepted this. I thought this. And so it can come up on us in a way that we least expect. And it catches our vulnerability. It catches
Yeah.
our places where we feel unsafe. And that's what's scary about grief.
We had a son that passed away of a congenital heart defect, and we were so blessed that the experience that we had, and hospice was so amazing and awesome. But this was almost 5 years ago, and
Mm.
when you say, these things come up, right? You'll see something, and it reminds you of a memory. And some of the ways, like, I have been able to process through is just I remind myself of a good memory of
Mm.
something that made me laugh, and it helps me process. I sometimes cry a little, and it's okay. But
Yes.
what are some helpful tips that you think individual would benefit from, just to sort of process some of those maybe emotions?
Well, I think, like I said, one, acknowledging them. Then, something that's familiar to you, because some people say, this garden, my mom didn't like flowers. So how can I do a garden in memory to her? Well, so what I might do to help me grieve my loved one is for me. It's for my process. So if I love flowers and I have a spot, this colleague I was talking to said I had a spot that kind of looked like a grave site. It needed some renewing. And so she purposefully chose that place to go plant wildflowers and remember her mother there.
Mm-hmm.
And laugh, because her mother might snarl at the fact that she's doing this garden, because she didn't particularly like flowers or whatever it is. So I think that's important. It doesn't have to be something that you don't like because the other person would like it. It needs to be your own process. And what you like. Maybe you like to journal. Maybe that helps you process. I don't like to journal. I'm not a journaling person, but I know a lot of people like to do it. And sometimes I'm in a place where my thoughts are so jumbled. I need to write some things down to help me organize my thoughts. So don't throw something away just because it's not something you typically like to do or that you would normally go to.
Since we're talking about bereavement and, with COVID, and we've had family members, some survive, some don't.
Yes.
Can you go a little bit over some survival guilt?
This is often something we talk about with veterans who have lost basically friends and family, who fight alongside them. And this is not that different, but it's not something that the general population often thinks about, but it happens. It happens when you have two people in a car accident and one survives and one doesn't. It's very real. And the thing about guilt is that it gets in our way of processing our own emotions. And so it can cause some complications in our grief. I think it causes people to process a lot of different things. What do I believe spiritually about what happens after life? The why questions that can't be answered. So if an open-ended nature to those thoughts, let yourself ask the questions. Why did I survive and she didn't? Why did this person that I don't like come through COVID and this very nice person over here die from this disease? And don't expect an answer right away. When you find yourself in those places, reaching out to someone else who's had a similar experience with loss, or a close friend that you trust, I think that's been highlighted, a highlighted need in our culture and society. Don't be afraid. You can talk to somebody one time or set up a relationship to have a therapist, for many weeks and months to come. But that's not just for people who are quote unquote crazy. When I was doing therapy, I would say the healthy people are the ones who ask for help. So don't be afraid to do that, because otherwise it will spiral out of control. And so that is always an option for any of us at any point in time in our lives, what we're facing, to reach out for that support.
One of the things I've also noticed, like loved ones, will tell, like if we'll tell the person who has lost someone close to them, like, I'm so sorry for your loss. They'll have a conversation and they'll say, call me, ask me if you need something. And I almost think that we need to be a little bit more specific.
Yes.
Because then those individuals will not call us. And, I know family and I know friends want to help.
Yes.
And they do want to contribute. So by saying that, sometimes I think it almost creates a barrier. So
Yes.
maybe even individuals who are supporting the person that's grieving should say, hey, can I get you your groceries? Or they could just say, I'm going to get your groceries.
Exactly right.
Give me the list. Like, what am I going to get?
If you give people the chance to say no, they'll say no.
Right.
Don't give them the opportunity. I'm going to bring you X. Or think about that person, your relationship with them. What do you know about them? And meet their need based on that. If you know they love chicken nuggets from Chick-fil-A, then get that for them and take it to them and send them a text and say, I'm bringing this at this time for your family. Whatever it is, because they can't tell you. Mm-hmm. They can't process. They can't think. They are muddled. They are sometimes stuck. And so, especially if you've had a loss, it doesn't even have to be a death loss. It could be the loss of a relationship, or a move and a change. Maybe you lost a job, and get in touch with those things that you needed at that time, and work to provide something out of that. Because so many times you've had a loss, so most of us have. People say things that are trying to be supportive and they're really hurtful. If you don't know what to say, it's okay not to say anything. I love you. Here's a whatever that you want to provide for them is more valuable than thinking of something that isn't helpful.
Right. And I think sometimes silence, just being with someone, in their just being present for someone, even if it's in silence, can be so powerful and so supportive, right?
We're not good at that, but yes, very much so.
Where now I find myself, sometimes I'm giving a patient bad news, and the
Yes.
fellows or residents are with me, and sometimes I'll say something, and then there's silence, and then there's more
Yes.
silence. There's more silence, and I think they're
Mm-hmm.
like, "Is she gonna talk? Is she gonna say anything else?"
Right.
But I
Right.
know, but oftentimes then the loved one of my patient or my patient will say something, and then I can meet them, and I, rather than me
That's
just
right.
kind of going on and on and on, I can get
Filling
something
space
from
that
them.
they can't hear anyway.
Right.
Right. Yeah.
So, what about like when to seek help when that grief process is not healthy anymore?
Yes. So if you find yourself staying in bed, I can't get up at all, thoughts of your own, taking your own life, of course. And some of those are passing thoughts. I wonder what would happen if this happened. I'm not talking about that. I'm talking about, formulating a plan. But even not as deep as that concern, increased anger in any emotion or strong negative sense that is debilitating. So if it is holding you back from anything, work, relationships, friendships, going to the grocery store, normal daily task, if you cannot complete those, maybe, and I'm not talking about after the few days after a loss, I'm talking about on and on, this is continuing to happen. Seek help. Ask someone, and it doesn't have to be a professional. It may just be a close friend, but do something.
One of the things I know hospice provides is support for, I think, sometimes even individuals whose loved one didn't pass away within that hospice.
Yes, that's right. That's right.
Can you talk about that a little bit? Like, how do people connect with a hospice and a hospice group when they never utilized that service and their loved one died? They didn't have a chance to.
Sometimes we are a connector, so we may not be providing weekly mental health care, but we can kind of help people assess what their need is and help them be connected to a community resource that can really provide what they need. Because sometimes needs arise out of loss.
Right.
We discover what we really need because of a loss. And so we can sometimes fill that gap and help make connections. And so that is one thing that we do. Sometimes doctors will send us referrals. This person seems to need some bereavement support, and it may not be something that we can provide them with, but we can connect them to the right place.
Which is, I think, so awesome about hospice. Like, it's not just for a person who is passing away right then. There are so many other services that hospice provides, and also the goal, right, is to provide that service for a long time, not like 1 or 2 days before a person passes away.
That's right. We have we follow our folks in bereavement for 13 months because a year after a loss is something new, and a holiday that you haven't experienced without that person before, a birthday, an anniversary. And so that's why we provide that service for 13 months following a death, depending on what people desire.
So how can people get connected to your bereavement group, the virtual bereavement group?
You can call our office. Our phone number is there, or on our website, and you can sign up. Our family support services coordinator's name is Mike, and you just email him. It's really easy. Hop on there and join the group. And we have a program that's built around loss and grief. And so people can connect and share their stories in a safe space that's protected, and connect with other people who may be experiencing something similar.
Okay. This has been great information. I really wanted to thank you for having this discussion with me, because it's not a comfortable discussion, even though it should be, right?
Yes.
It's a natural part of all of this.
Yes.
So, any other advice or suggestions that you have?
I would just say that Grief can be a gift if we let it move us through our memories and our love. We don't grieve if we haven't loved. And so we can allow our grief to be an extension of our love. And I think that that picture can carry us on.
Thank you so much for joining me today. And I hope that our listeners take some good advice away from this podcast episode.
Thank you so much, Dr. Shersall. I appreciate it.
Oh, absolutely. Have a great day. Thank you.
You too.
Thank you for listening to this episode of the Jerry Academy podcast. Learn more at jerryacademy.com or follow me on social media for information on future episodes.